All right, let's go ahead and get started. Start almost on time, 5:02. I definitely want to respect everybody's time because I truly appreciate you all taking the time to join me on this presentation. Today, obviously, I'm going to be talking about metabolic health markers, more specifically, what you need to know for optimal weight loss. And my name is Sherry Stoka, and I will talk just a tiny bit more about my history and why I'm here today. But let's go ahead and get started because I know everybody's really anxious about this particular topic. Okay, so today we're going to talk a little bit more. Actually, I'm going to minimize that. We're going to talk a little bit more about metabolism and what it means to be metabolically healthy, because I feel like that word is kind of thrown around a lot, and I don't really think, many people really think about what it actually means. There was a recent study done a couple of years ago. I keep citing this study. It's probably more now, but approximately 88% of Americans have some type of metabolic dysfunction, and most people don't even realize it. We're going to learn about what starts the disease process and progression. And I'm going to go into detail about different biomarkers that reveal your metabolic health status. We're going to talk a lot about cholesterol. So many myths that surround cholesterol. And then, of course, we're going to end with details about our metabolic reset program that we do 3 times per year. So, sorry, when I let people in, I have to go down in. All right. So just a little bit about me. I have just a deep passion for digging deep into the research and understanding how things work. It's all about the foundation. It has always been about the foundation. Even as a young child, I just always wanted to know why. It wasn't good enough to just get the answer, because until I really fully understood why things were happening, then it never really resonated with me. So that's kind of how I approach my business. My experiences and circumstances taught me many lessons. We all are here to experience this journey, right? And nobody goes unscathed. We're all experiencing life, and we have challenges along the way. And my challenges just happen to really make me go through this health process that really caused me to think differently about how we approach health. And what I believe today is that our conventional system, the system that we are all exposed to every single day, is not designed to get us healthy. It's not designed to fix the problem. It's designed to manage our illness. And, again, I'm going to talk more about it, but that is what I firmly believe. And again, my health ultimately transformed the way that I think and the way that I practice and the way that really I continue to build this business. So just a little going back into the past, I didn't really start working until I was about 30 years old, because it was all about soccer. I played soccer my entire life at a very high level. Ended up going to UW-Madison, played soccer there. Went on to Mount Mary to do a master's program in nutrition. I have a certification in integrative health and functional nutrition. Most people don't know what that means, but it's really just digging deeper into how the body works and how food affects the body and that type of thing. I have a certification as a LEAP therapist, and that's stands for lifestyle, eating, and performance, more specifically geared toward food sensitivities, how food causes destruction and inflammation in the body. And again, my life was sports. And so this did play a big role in how I perceived health and what I was taught. And so those experiences, kind of led me up to where I am today. And I'm so grateful for so many different things in my life and where I am. So again, I'm just really excited to bring new information to you all this evening. So in 2015, I opened up Weight Loss MD. And, I'm a registered dietitian nutrition. Yes, I have other certifications, but, I am the only quote unquote medical weight loss clinic that is run by a registered dietitian. So most medical weight loss clinics are run by like nurse practitioners or physicians, which again, I find that it differentiates us because we dietitians are experts in nutrition, and food is the foundation. You can do things all day long, every day, but until you're feeding and nourishing the body, you're going to be fighting all the imbalances until you get to a point where, those cells are being fed appropriately every day. I truly believe that we have to dig deeper and we have to look into root issues. At WellSMD, we create and design all of our programs because we address multiple facets of the imbalances in Americans today. And, you'll better understand that as I go through this. We are experts in weight loss. I truly believe that nobody does it better than us. Of course, that's just me saying it, but I truly believe it. We understand everything that we create. We think through so strategically, and we also practice it and try it on people. So we know what things will work. We know what doesn't work. In 2022, I franchised the business. So my goal is to ultimately take this model and take all of the different programs and systems that we have developed and expand so we can continue to help people. And we have been do that over and over again. So I'm going to just start with a basic definition of metabolism, and I'm going to try. I'm going to go pretty quickly through these slides. At the end, absolutely going to open it up for questions, but sometimes I feel like it's good to kind of go back to some of the basics. And when we think about metabolism, again, we think about, do I have a good metabolism? Do I have a bad metabolism? But really what it is it's this chemical process that takes place in the body at all times. And so essentially what it's doing is converting food and any type of, drink or calories that we're consuming. It tries to take that substrate and create energy. This is an extremely complex process that combines certain calories and oxygen in order to release energy, because the body requires energy. And metabolism, like I said, it never stops, even when you're at rest. And so what your metabolism is trying to create is energy, not only for burning calories, but for breathing, circulating blood, digesting food, growing and repairing cells, managing hormone levels, regulating body temperature. So we have to provide energy in order for these systems to continue to happen. So I'm going to touch a bit about the basal metabolic rate. We do talk about this because we measure this in our clinics, but your basal metabolic rate refers to the minimum number of calories your body needs to function when you're resting. So if you knew what your basal metabolic rate was, then that would literally be the number. So that would be the amount of calories that your body needs to function. So that would not include anything like exercise or moving or gardening and things like that. So it's just like bare minimum. So keeping in mind that we're all kind of taught that we have to decrease the calories. And at the end of the day, your body's going to start fighting you when you keep decreasing it, because it's not fulfilling the normal, functional needs. Weight loss and aggressive calorie restriction actually decreases your basal metabolic rate, which a lot of people kind of think the opposite. And the healthier and leaner you are, the lower your basal metabolic rate is. So we do have patients that come in, and not everyone, a good number of people, they don't understand why they keep gaining weight when they are doing the same things. You know, the diet hasn't changed, exercise hasn't changed, but there's a lot of confusion. And usually people come in and say, well, I think it's just my metabolism. I'm getting older and my metabolism is so slow now. And so I'm just here to tell you that metabolism is rarely the cause of weight gain or weight loss. So we talked about basal metabolic. Sorry. We talked about your basal metabolic rate. And so then taking it a step further is your total energy expenditure. So this is taking your basal metabolic rate plus any type of physical activity, plus actually the type of foods you eat, depending on what you're eating, requires more energy. So if you're just eating, you know, sugar all day long, that requires very little energy. But if you're eating complex carbs, fiber, vegetables, fruit, protein, that has a higher thermic effect. So again, you know, the foods that we eat play a role in your overall basal metabolic, not your basal, but your total energy expenditure. Hopefully that makes sense. So just a bit about fast versus slow metabolism, again, because it is something that people just throw around, not really having any real idea what it means. But a fast basal metabolic rate absolutely will burn more calories while at rest. We all know those people. You know, they're like, oh, they eat poorly, they can eat whatever they want, they still lose weight. And so there are, you know, certain things, genetics involved and things like that. But typically, things like that are often altered as other factors come into play. But your fast metabolism doesn't necessarily lead to thinness. In fact, most of the studies show that people who are overweight or obese actually have fast metabolisms, and I'll explain a little bit more about that. But it really is about their bodies really requiring more energy to keep up with the basic functions. And of course, when you're heavier, that takes a lot of energy to carry around that weight. So, you know, the more weight that you're carrying around, the more muscle that you actually have. There are certain metabolic disorders, absolutely, that would not fall under this category. So there's inherited, you know, metabolic disorders that do not respond to any type of calorie deprivation or exercise. And I just list them there because I want, you know, not that these are common, but there are always exceptions to the rule. So certain factors that affect your metabolism is really your lean body mass. You know, how much muscle, how much fat do you have? Because the more muscle you have, the more calories you're going to burn. Your age, absolutely, you know, as you get older, your muscle mass declines. And this is something that I don't think people are hearing about. And it's absolutely crucial that we try as we age to maintain a certain amount of muscle mass, because that's not only going to dictate your metabolic health, it's going to dictate so many other things that are so important, you know, as you get older. Your sex, obviously, you know, most people know that, you know, men, you know, their metabolisms are better, and you know, they tend to lose weight easier, but that also has to do, you know, with their higher muscle mass, you know, testosterone and things like that. Genetically, you can absolutely inherit from your parents. So typically you see trends in a family, you know, if you know, you don't really see like one or two people overweight, obese, and then you see two lean people. So there definitely is a genetic component to that. But again, it's not just genetics, because it's kind of what you're taught and what you do as a family. It's those behaviors that follow kind of the genetic predisposition. Physical activity, obviously, you know, the more active you are, anytime you can build muscle and things like that, that's going to really help your body, burn and use energy. And then, of course, just your overall body weight. So this, I don't know if you can really see this as clear as I really don't see this as clear, but what I want to point out in this particular slide is that you look at this. So this is one of our clients, the total weight is, he started at 223. And so after a program, they went down to 162. So what I wanted to demonstrate here is that the basal metabolic rate at the weight of 223 was 1563. So that was their current basal metabolic rate. When they lost the weight, their basal metabolic rate went down to 1394. So again, your metabolism is always adjusting to kind of like the whole picture. And it's not just about weight. I mean, we're looking at muscle mass. We look very specifically at muscle mass, but we also, what's a big driver of our ability to lose weight is visceral fat. I'm not really talking a lot about visceral fat in this presentation, but if you don't know where you stand as far as like that visceral fat level in your belly, that's going to play a huge role in your ability to lose weight, because if your visceral fat is elevated, it kind of alters so many different systems and things aren't working properly. So again, the whole point is when you're losing weight, you typically see the basal metabolic rate go down, but that really means that your body is just kind of running a little more efficiently and doesn't require as much to do everything that it needed to do before. All right. So does obesity cause metabolic dysfunction? And sometimes I do these presentations, but I love to hear just how people feel about this, because I do think it's like obesity causes heart disease and cancer and autoimmune. I mean, there's just so many things that we hear. And actually, that really is not true, because metabolic dysfunction happens way before obesity or diabetes sets in. And I'll kind of explain that. But if you kind of think about, if you are listening to this and you're on medications for maybe blood pressure or cholesterol or reflux or what have you, if you think about your weight when you were first prescribed that medication, you likely weren't obese, that was probably earlier on, but that was the early sign for your body basically telling you that, things are starting to happen that is going to lead you down the road of destruction, essentially. So obesity is not the cause of metabolic issues. Obesity over time is a symptom or a consequence of these long-term metabolic consequences. So maybe it starts as blood pressure issues, then all of a sudden, okay, now you're on for cholesterol, now you got reflux and gut issues. So all of these things are leading up to, oh, okay, now you can't lose weight, now you really can't lose weight, and now you are obese. So it's my whole point of this is that if you believe that obesity is the cause of all of that other stuff, you just kind of reverse that thinking, because that's kind of how it happens. The body slowly begins to adapt to altered metabolic processes, when you have these early issues. And then ultimately, like I said, it just makes it very difficult to start to lose weight because of, I do so many different presentations on it, but it's just that your body's not going to the right resources to burn calories. Obesity is a state that really causes blood sugar dysregulation. And again, just kind of hitting the fact that it's an inability to use certain fat stores for energy. So like visceral fat, very inflammatory, actually produces its own fat cells on its own. So those no longer become an energy source because it's damaging to the body. So again, it's just this altered state of metabolism. So the causes over time, I mean, it happens over time. How many medications are you on? Are you overeating? Are you inactive? Do you not sleep at night? Are you genetically predisposed? Are you smoking? How is your gut? And are you drinking soda all day? So it's all of those things over time that start to lead up to metabolic dysfunction and then obviously obesity. So conditions related to metabolic dysfunction, I kind of mentioned them, but it's like hypertension, hyperlipidemia, hyperglycemia. And again, so it could be LDL cholesterol, high blood pressure, high cholesterol, autoimmune conditions, obviously diabetes, even mental health issues. Probably another presentation I'll do, but hormone imbalances, it causes hormone imbalances, just low-grade, constant inflammation in the body. And just so we all understand today that the body is not isolated in certain areas. It is all connected. So you might see a doctor for your kidneys, or you might see a doctor for your liver. You might see a doctor for your gut, your GI doctor. And at the end of the day, like the day I won't be alive to this day, but the body is constantly in communication. And disease is not isolated in one specific area. So just a slide inflammation, because I will talk a little bit more about it, but we talk about inflammation all the time, and that it is foundationally kind of the root of every disease. And it's super duper important to understand that inflammation, like acute inflammation, is a normal process in the body, because it is what protects us when we get injured. So an acute inflammation is, something like you ate something, allergic reaction. You have the flu, you have an infection, you got in a car accident, you cut your finger off. So the body's response to that is inflammation, immune system involved, immune system coming to fix the problem. So that's a very normal process. What we're talking about when we talk about inflammation is low-grade, constant injury. So now this acute, inflammatory state becomes chronic in nature because of the state of our health. So whether it's, cardiovascular disease, again, like we might be treated with a medication, but we still have some issues going on. GI, intestinal tract, autoimmune, rheumatoid arthritis, cancer, dementia, reproductive disorders. So there's so many different conditions that are keeping us in this chronic inflammatory state. And this chronic inflammatory state is, kind of like we're trending now towards, the worst case scenario. So how the body, we do have genetic predispositions to develop certain diseases for sure. And it really depends on, genetics do play a role, but it really depends on where your vulnerability is. Because when the body is in a sick state and things aren't working properly, it's going to attack certain areas. So it really is about where your vulnerabilities are. And usually inflammation starts at like the joints, the smaller areas, because that is, those are the areas that don't really have a lot of blood flow, nutrients and things like that. So usually people will feel like their wrists or elbows and things like that. So again, there's complexity to it, but when your body is being, when your body's vulnerable to disease, it's going to choose the most vulnerable areas. So inflammatory conditions, these conditions kind of keep you in an inflammatory state. So the thing is like most people don't even realize they have inflammation. So this is like a key thing. Like, do you have inflammation right now? Like nobody knows. So the whole point of this presentation and then the things that I talk about is going to help you understand where you are, because inflammation is the foundation to every disease. So if you are obese and you have excess fat, that's an inflammatory condition. Diabetes, inflammatory condition. Autoimmune, inflammatory condition. Anything, if you diagnosed with anything that has itis at the end, it's inflammation. Itis means inflammation. Leaky gut, food sensitivities, every time you eat something, you get a response, inflammatory response. Environmental sensitivity, allergies, stress, and the whole cortisol connection, lack of sleep, oh man, disrupts the body so much. So these are things that are contributing to that progression. So why does all this matter? Well, I was having a discussion with my family, my mom and my sister the other day, and they're like, oh yeah, people are living longer, we're so lucky we have all of these medications. And I'm like, what? So anyway, we are not in a healthier state. We might be keeping people longer in a bed and on a ventilator or whatever you want to call it. But the fact of the matter is that 88%, this was a study a couple of years ago. It's actually more now. I recently read, but so approximately 90% of Americans have some type of metabolic dysfunction. 90% of people with pre-diabetes have no idea that they have it because our testing is not great. 30 million Americans have diabetes, 32% of Americans have hypertension, 71 million US adults have high cholesterol, and 2/3 don't know how to control it. And people don't realize that they're a doctor visit away from a diagnosis. And so that's how our system is. It's kind of like, let's just, keep managing this ill state until, boom, you show up on that test. Now we're like, okay, let's give you that medication so that we can fix that result on that test, on the test result, and then everyone thinks that they're fine. So I'm going to talk a little bit about that. But why are we Why are we sick and unhealthy? We have so many resources. We should not be like this. And the fact of the matter is that we're fed poison. That's the fact. And 70% of our diet is chemical based and sprayed with a lot of stuff, including Roundup. And the majority of people you actually can test the amount of Roundup in your body, and the majority of people have a lot of it. And that is the stuff that you kill the weeds with. We drink contaminated water because our water is absolutely not safe. We breathe unhealthy chemicals, metals in the air. We're exposed to radiation 24 hours a day. There are some things we absolutely can't control. And so this is the hard part that I deal with all the time because of the industry that I'm in, and this is my passion. But I have to take a step back and say, I have to focus on things that I can control, because I can't control everything. I can't control the fact that I have to sit in front of a computer to do work often. Like, EMF there, I travel a ton. I'm on, I go through the airports. Well, I don't go through those things because I got, the special, I forget what it's called. But so you do what you can control. You try not to stress about things that you can't control. That's always been, not always, but I've learned that about myself. It's like, don't worry about things that are just nonsense. Not nonsense, but things that there's nothing that I can do about it. And then the other piece to that is that we're told to fix all of these issues that we have with the pill. And the pill, the majority of the time, masks the symptoms, creates a blood test or whatever to look good. But the body is not getting better. The body actually gets worse the majority of the time, while the metrics or what have you, look okay. So again, I'm going to be straight to the point. I'm super passionate about this. This is my mission in life. We all have it. And, when I look at people around me and I look at my aunts and my uncles and things like that, I'm like, nobody lives like this anymore. Nobody's exercising. Nobody's, going out for long walks, doing yoga. We're not doing that anymore. And so my whole really a mission is like, just think about that, because this is your choice, and only you can determine your health. If you're relying on pharmaceuticals and algorithms that are taught and, basically driven down in medical schools by the pharmaceutical companies, that is absolutely your choice. But we're here to give you a different perspective. And I think it's really important to understand where you are so you can prevent health, because 80% of diseases are lifestyle driven, and they're all preventable. Sometimes it is you pass that point of irreversible disease, but 80% are lifestyle driven and they are reversible. So, and I heard this once a while back, and it's so true. It's like, we weren't put on this planet to suffer until we die. We were put on this planet to enjoy life and experience life. As we age, we're meant to get, wiser and have just different perspectives and share our wisdom. But now I feel like people are suffering and just, trying to get through day to day. And this is like our new normal. And so again, people that listen to this may think that whatever I say is just like I'm crazy or whatever, but this is just why I was put here to communicate health to as many people as I can. All right, so let's prevent disease, not react to it. We live in a medical system that is reacting to disease. So general labs are basic screening tools. We're all doing it. Oh, you didn't have your blood work done? Yeah, it was great. I haven't heard anything. So just kind of keep that in mind, that that's not the, tell all look at, what's going on in your health. How you feel is super important. And don't ask the person next to you, because they're probably feeling the same way. Like, you should feel energy. You shouldn't be tired throughout the day. You should have clarity in your brain. And there's things that you should feel most days. Your lifestyle habits are crucial, because they all come into play. How often are you sleeping? If you are a stressed person, that is the absolute first thing that you need to get a hold on. Are you a negative person, or do you have a positive outlook on life? It's huge. I mean, you don't realize these neurotransmitters, hormones that are constantly being produced just about when you're thinking about things. But now we're going to just dig deeper into labs that most people are not getting regularly, and they can, to really, you'll know sooner rather than later if there's something wrong that's been going on. So we hear this a lot. We're like, oh, have you had your blood work lately? Yeah, I did. Actually, I haven't heard anything, so I think I'm good. I mean, we hear this all the time. So we're all about metabolic health. Metabolic health, I mean, we're all about gut, but we're all about metabolic health too. And so it's crucial for, we're weight loss, obviously, but it's crucial for weight loss, but it's crucial for so many other things. And so I'm going to dig into the different markers that you can actually do today. I'm going to make it easy for you at the end, but this is for your information, and you can jot this down. You can go to your physician. You can ask for this stuff. They can run this very easily. So CRP, so C-reactive protein. So these are all blood tests. This is a protein that's going to check for the low-grade inflammation in the body. So like I said, inflammation is the beginning of there are those genetic diseases that maybe inflammation is not playing a role, but the majority, inflammation is the foundation. If you have elevated CRP, there's some type of possible infection, and it's also going to reveal how your immune system is reacting, because anytime you have an overactive immune system, it means you have inflammation in the body. So if you have like moderate levels, you're 4 times more likely to have a heart attack, and also periodontal disease. This is another huge area that we talk briefly about it when we're meeting with people. Do you have Do you have cavities, amalgams? Do you have, the mouth? Think about it again. If the body's all connected and a lot comes through the mouth. So if the mouth and you have periodontal or, so many things going on, that may be, what you need to focus on. But higher levels mean there's active infection or there's some type of autoimmune condition that's already set in. So again, any type of autoimmune is some type of inflammation. Again, itis, bronchitis, rheumatoid arthritis, hepatitis, those are all inflammation in the body, inflammatory conditions. Vitamin D, everyone please either do what I'm going to suggest at the end or go get this tested. It's estimated that almost 50% of US adults are deficient. 84% of African Americans are deficient. It's a huge problem. I think we all kind of heard about vitamin D during COVID, and people that had normal vitamin Ds did not get the infection. That's how powerful vitamin D is. It plays a role in bone health, brain health, and immune health. And again, easy blood test. Majority of people are deficient. So signs of a deficiency would be if you are someone, chronic infection, sinus infection, respiratory, you're just, whatever the infection is, you have certain pain, bone and muscle pain, you can't sleep at night, insomnia, anxiety and depression, hair loss, weight gain, and fatigue are all signs of vitamin D deficiency. Homocysteine. Again, nobody's getting this level checked, and you can get it checked. This is an amino acid that's present in every cell of our body. And it is essential for so many things, but in our day and age, the majority of people are living in a stress state, or they have some type of what we call like methylation issue, which again, I'm not going to get into, but so what happens is our B vitamins like B12, B6, folate are being used up rapidly because we're in a stress state. So a lot of people have like these they have B vitamin deficiencies, and B vitamins are crucial for metabolizing homocysteine. So if you don't have the B vitamins and you can't metabolize or clear homocysteine, that increases your risk for certain heart conditions significantly. High homocysteine impairs endothelial function and endothelial homeostasis. So basically like the narrowing of the arteries. And it also regulates pathways that regulate like our vascular tone, inflammation, angiogenesis, which is actually a regeneration of blood vessels, because our body's always trying to repair, and just oxidative stress. So the whole point of this is if you have high homocysteine, it is something that needs to be addressed immediately. And the cool thing is like it's so easy to address, because you have to be that person that takes B vitamins every day, but it has to be a certain type of B vitamin for sure. But again, this is not complicated stuff. These are easy fixes if you know what the problem is. Signs of elevated homocysteine, paleness, weakness, fatigue, brain fog is huge, tingling, dizziness, mouth sores, anxiety, panic attacks are huge. And I'm just going to throw it out there because I feel like I tell the story all the time, but my husband, we were doing some testing on him. This was like a couple of years ago, and he always knew that like cholesterol, he had like this familial genetic cholesterol issue, and we don't go to the doctor often at all, but we did some testing and his cholesterol was super high. It was over 300. He was having anxiety attacks, and so that's why I was like, oh, let's just do some testing. And we did we checked homocysteine. I checked some other levels. And so the homocysteine was elevated, and there was, I don't remember the other marker, but the second we started replacing the B vitamins, the cholesterol went down to normal within I'd say 2 weeks. I don't know. I mean, we tested it like 3 weeks later, 3 weeks later. Normalize the cholesterol, all the panic attacks, all of that went away. And so, we're like 3 years out, and we just did another test, and his cholesterol still normal. He's still on the B vitamins, but this is just, of course, one example, but it was pretty significant because we knew exactly what the problem was. Complications of elevated homocysteine, since like high school, I couldn't say the word, but atherosclerosis, blood clotting, heart attack, stroke, dementia, again, all connected, dementia, Alzheimer's. Insulin. Okay, well, insulin, I think most people know, very much related to diabetes. When you get your blood test done, you're looking at your blood sugar level. Well, okay, so let me just read my slides so I don't get ahead of myself. But insulin is a hormone that basically transports sugar out of the blood into the cell, so the cell can actually use it for energy. And so insulin is the driver of that. So if you're eating a lot of like carbs and sugar, you're relying on your insulin to kind of come in, attach to the sugar, and take it out of the blood. So what happens over time is that elevated insulin. So if you were to get your insulin level checked and it was elevated, which it shouldn't be elevated, because that's, again, the beginning sign of something. If it's elevated, it means that your pancreas, because the pancreas is what secretes the insulin, is overproducing to get, either because you're eating too much sugar, or what happens over time is that now the cells that the sugar needs to get into, they actually they shut their doors, and they're like, no more sugar is coming in. Insulin, you have been working overdrive trying to get into the cell, and we're done with you. So now insulin is elevated, blood sugars are elevated because it can't get into the cell to be used. So now major destruction begins to happen because the sugar sits in that blood. And when the sugar sits in that blood, the damage that happens is pretty significant. And then obviously the body has a mechanism to get the sugar out, but that's what goes into like the visceral fat and all of that. But the point of this slide is that your blood sugars can look totally normal for a long period of time because the insulin is either overworking to try to regulate the blood sugars. But if you can check your insulin right now, you're going to know way before the blood sugars become elevated. So again, it's just about being more doing tests that provide insight into to what's going on before the actual diagnosis happens. Just some symptoms that maybe your insulin levels are being a little, they're being challenged and overworked. Acne, skin tags, belly fat, high blood sugar, obviously. You're tired after meals, weight gain, you don't know why. Some people just gain weight. They're like, I'm not even eating and I'm gaining weight. Hyperinsulinemia. You crave stuff, hair loss. You could get fluctuations of high blood sugar, low blood sugar, because sometimes insulin overshoots and then too much gets pulled out. So these are just some symptoms to kind of see if that may be happening to you. And then cortisol, a lot of people, we've heard about cortisol. It's a hormone that's produced in the adrenal glands. It basically is there to increase blood sugars when they become too low. Because if blood sugars get too low, we could die. And so that's why cortisol is there to kind of come to the rescue. But, it can be, problematic because we all hear about, cortisol is elevated. I don't sleep, high cortisol, I'm stressed, high cortisol. So every time you're experiencing those things, cortisol is going to drive up your blood sugar. And cortisol also, when it's elevated, can actually use muscle protein to make glucose when needed. So sometimes when people are in severely restricted calorie diets, such as like the keto diet, the body needs glucose, which is carbohydrates. And if you completely remove that source of energy, it's going to be a stress on the body. The cortisol is going to be increased, and cortisol can actually make sugar or glucose in the body by using your muscle. So that's why some people on the keto for long periods of time, they start to lose muscle mass when they're like, wait, I thought keto, I'm supposed to burn fat. But again, it's just not understanding the whole, how the body works. So if your cortisol stays elevated for long periods of time, it significantly enhances the aging process. Like I said, it controls blood sugar. It also can completely shred brain tissue, causing brain atrophy and depression. Lots of studies there. And again, it's kind of one of those things where, you know, you have to look a little bit deeper, because if we're just focusing on blood sugars, you know, we're missing the background, you know, other big pieces that really could be telling us a different story. Symptoms of high cortisol would be weight gain, mainly in the face, chest, abdomen, contrasted by slender arms and legs, a flushed and round face, high blood pressure, bruising, muscle weakness, and mood swings. And so I'm going to talk a little bit about cholesterol, and this is the last biomarker. And then we're going to just get into like metabolic reset, and then I'll get close to wrapping up, because I know, you know, we're getting close to the hour. But this is super duper important. Cholesterol, some of these things are going to maybe surprise you. Probably all these things are going to surprise you. And you'll hear it, and you maybe it won't resonate with you, because we have been told so much in the media, and you know, oh gosh, cholesterol, get on a statin, cholesterol is dangerous. But I'm going to take you through it, and you can take the information and hopefully, you know, learn a little bit something from it. But so cholesterol, there is no conclusive evidence that showing that high cholesterol levels increase the risk of cardiovascular disease. Okay, so you can write that down. I mean, because that will, so many people will be like, wait, what? Yes, cholesterol causes heart disease. There's been more studies done on cholesterol known to man. And most of them are, you know, kind of done by companies that are trying to get you to do things. But what we know now is that conclusively, high cholesterol levels do not increase your risk of heart disease. Dietary cholesterol does not increase your cholesterol levels. That is also true. And that is also why cholesterol has been removed from the food labels. Because finally the FDA was like, oh yeah, okay, there's enough evidence showing that dietary cholesterol does not contribute to high cholesterol, meaning blood tests, checking that. Now, what's important to understand is that the standard American diet, meaning processed foods, carbs, bagels, sugar, processed fats, that absolutely can lead to high cholesterol. Cholesterol levels above 300 usually have a genetic component. Lots of confusion around LDL and HDL, but it's really, really important to know that if you do get a lipid panel and it doesn't make sense, LDL, because LDL definitely is kind of like, has more research showing that it is tied to, certain cardiovascular events and things like that. But what we know now is that we have different types of LDL cholesterol, and it is the type of LDL cholesterol that you have. It's not just the LDL, general lipoprotein. And it's more about like the oxidized, which, we're not going to get into that. But also keep in mind that if you do a lipid panel and you have really high LDL and, your health is a mess, but your doctor's like, oh my gosh, your LDL was high, so your ratio is good. So LDL is high, HDL is not always protective either. So again, I'm not digging into it, but it is something to maybe think about if you were told that. What is the cause of cholesterol? Okay, so we're told that it's the food, right? We're told that it's cholesterol and, the eggs and the meat and all the stuff that's in our diet. Like, that's what causes high cholesterol. That's not what causes high cholesterol. What causes high cholesterol is poor thyroid function, a fatty liver, if you have infections, leaky gut, kidney disease, high carb diet, high sugar. And so all of these things affect cholesterol levels, and I'll try to explain why. But I'm going to talk about this first. So this is where what I think is really important. If we know that cholesterol is due to all of those other things, like why is statins the only option to lower cholesterol? So if we understand what statins do, they are designed to reduce the amount of cholesterol made by the liver, and they are designed to remove cholesterol from the blood. Makes sense, right? But I will get into the other stuff. Studies done by all the pharmaceutical companies, all of these, there's so many studies on cholesterol and statins and things like that. But they show that statin use decreases heart attack or stroke at best by 1 to 2%. That's the best that they've been able to show. Studies also show that placebo was 1% less effective than a statin.
Something to eat.
If you there's some people that have they're not muted, so if you could just check that would be awesome. There's no significant differences in all-cause mortality in adults greater than 65 years of age on a statin, versus usual care. So basically, there's really not any proven benefits to statins, but there actually is a lot of research on the adverse effects and the potential side effects that can be debilitating. So I'm going to go through these. 1 in 4 Americans over the age of 45 are on a statin for high cholesterol. 52%, there's a 52% increased prevalence of calcified coronary plaque compared to non-statin users. So if you're on a statin, it's going to increase your risk. Type 2 diabetes with advanced atherosclerosis who were on frequent statin users have significantly higher coronary artery calcification. Again, it's increasing this risk of the calcification in the arteries. Statins increase risk of type 2 diabetes. In one study, statins showed that the risk of type 2 diabetes in postmenopausal women increased by 48%. And I'll talk a little bit about this, but now the PDR, which is kind of like the manual for doctors, it's on there basically stating that anyone who is on a statin needs to be on CoQ10, because CoQ10 is one of the most important antioxidants for the heart, and it completely blocks that production. So just to elaborate, I'm not going to elaborate on this one, but there's so many studies that show how, this CoQ10, which is an antioxidant for the heart, and how statins completely deplete that. And when that is depleted, it causes multiple issues, which I'll talk a little bit about. So the adverse side effects of statins are nerve damage in hands and feet, hands and feet, immune suppression, immune depression, pancreas and liver dysfunction, sexual dysfunction, exercise intolerance, just talked about CoQ deficiency, inhibition of K2 synthesis, which is your body's ability to transport calcium correctly, which I said is, that's increased in risk of that calcification, and then reduces ketone production, which again, we won't get into because that's just more diet driven. And if you go on the FDA website, it says it admits to all these statin uses. FDA has labeling guidelines warning users that statins can cause memory loss, elevated blood sugars, type 2 diabetes, muscle damage, and liver disease. The reports on memory loss and forgetfulness and confusion span all statin products and all age groups. They are recommending statins for kids now, just so you know. Raised blood sugars and the development of type 2 diabetes have been reported with the use of statins. So this is right on their website. You know, you just can't make this stuff up, but this is what is being pushed out to us. I mean, I'll just leave it at that. So I'll end with this last, well, I don't know if it's the last slide, but cholesterol is actually one of the most important nutrients in the body. So it's essential to every cell in our body, especially the brain and the spinal cord. It protects your brain and your memory. It makes the bile. It is essential for sex hormone production. If your cholesterol is super low, you probably have like sex, like libido issues and things, because you can't even produce enough testosterone, estrogen, etc. It's essential for the absorption of fat-soluble vitamins. And again, a very important point is that studies, again, there's so many studies on cholesterol, but what we know today and what has been conclusive is that all-cause mortality increases with a low cholesterol. So with cholesterol less than 125. And so again, this might shock a lot of people, but I mean, this is kind of what we're taught. So just to wrap up the cholesterol part, you know, just because high cholesterol doesn't increase your risk of heart disease or stroke doesn't mean you should ignore it, because high cholesterol is our alarm system. It is always at the scene for repair. So if your cholesterol is elevated, it's because your body's out of balance. Something's going on. And so typically there's inflammation. Inflammation drives the immune system recruits cholesterol. It's at the scene. So how I explain it to people is, it's like if there was a fire and, you know, there's a bunch of people there to like put out the fire, and they're always blaming the firemen for the fire because they're always there. I mean, that is how we perceive cholesterol and how we treat it. Because it's there, it's really there to help, but we're basically have created this dialogue that we need to just get rid of it. So that's my take on the cholesterol. So what should you do if you have high cholesterol? I just wanted to add this quick slide because that would be like what I would want to know is look at what else is going on. What is your diet? Are you eating a lot of processed foods and sugar? Because that can drive it. Are you sleeping only 3 to 4 hours a night? That can drive it. Are you on multiple meds? What is your stress levels? Do you have inflammation? So it's really, again, it's the cholesterol is telling you something that something's going on. So I touched on those main markers. Some other important markers to look at, like overall metabolic health, would be like testosterone for men, estradiol, DHEA for women, hemoglobin A1C, which is a 3-month average of blood sugars, TSH, which is your thyroid, your thyroid function, obviously all of your lipids, and then there's what's called apolipoprotein A and B. So this is kind of like, now in the research, this is kind of like the standard of care if you really want a good snapshot of your risk for cardiovascular disease, because the lipid profile is just so generic. So now, you guys can look this stuff up, but this is something that if you're worried about, or you have a health history of like heart disease and stuff like that, the apolipoprotein A and B are huge. Okay, so WellSMD, we're all about getting your body into a healthier metabolic state for optimal weight loss. Your diet definitely will depend on your state of health. Low carb is usually necessary if you have metabolic dysfunction. If you don't have metabolic dysfunction and you're a healthy person, then you probably should not be doing high carb and keto and all of that. And just to touch on keto, because I did a whole podcast on it, it is something that please know about. Please work with somebody that knows, about the keto diet, because any keto diet long-term is pretty bad on the body. And again, I know this is long, so I'm not going to get into it, but it is good for short-term purposes. But if you're always going to it, or you're staying on it for a long period, and you notice you're just not feeling well, it's because it's not great long-term. All right. So I'm gonna quickly run through